Greetings, this is Mushtaq Memon, Professor Emeritus from Washington State University. I am really delighted to be in Istanbul, especially with my friend here, Dr. Erhan, who is a veterinarian, and he is very kind enough, him and his wife, to bring me over here. And this is just a beautiful spot. So I think I will turn around this camera and let Dr. Erhan tell us more about this outstanding, impressive area. Dr. Erhan, please go ahead and tell us about this area.
Yes, we are now on the Asian side of Istanbul. Between Asia and Europe is the Bosphorus, and now we are on the Asian side of Istanbul. And this is the highest part of one of Istanbul's areas in the Asian part. We call this Çamlıca Tepesi, and we are on the Çamlıca Tower now. That's what we see here is the Çamlıca Mosque. It's built newly before 4 or 5 years, and it's a very big mosque. It's the biggest mosque of Turkey now, and at the same time there can be 60,000 people make prayer at the same time. And all this area that we see is Istanbul. Istanbul is a huge city with over 70 million citizens.
So these buildings are more kind of apartment buildings, or they're offices here?
Yeah, you will see the skyscrapers here. These are working areas, and the other areas are citizen areas. These are where the high buildings are most offices, working offices, because this is a capital of finance. So we have much of these buildings we can see in Istanbul.
So Istanbul, you are saying, is a more kind of capital of all the finances and business and banking.
Yes, everything is in
Turkey.
Istanbul.
And you were saying that this is a very busy city, and there may be close to almost 19, 20 million people.
Yes.
So which is almost one-fourth of the country.
Of the country, yes.
Yeah.
It's the heart of the country.
Heart of the country. Wonderful.
This is the Mediterranean Sea that we see here over, and there are 4 islands. There are living also citizens from Istanbul there. They have a regularly ferries who are visiting and taking the people to Istanbul to work, or the tourists to these islands. And these islands are very, very popular, especially in the summertime, because there are some beaches on these islands. So many people going there also for swimming.
So am I correct assuming that we are on the Asia part of Istanbul?
Yes.
And you mentioned about this Mediterranean Sea, and after the Mediterranean Sea, we have the European part of Turkey.
Yes, we will see this later.
Okay.
That what we see here is the Mediterranean part. We're also now seeing of us is the Anatolian part, and this is the Anatolian harbor that we see there. There's a big building here. This is the historical train station. There are not coming now trains, but it was the biggest train station of Istanbul. It's a very, very nice building. But it's worked not as a train station now, just as a touristical place. And when we go to this side, we will see something interesting here. Exactly here is the Bosphorus beginning. On the over side of the Bosphorus is now the European part, and that what we see here is the Golden Horn. Is the historical, the oldest part of Istanbul, where is the Hagia Sophia, the Blue Mosque, the Great Palace is also here, and many, many historical sightseeing places we can see here. If we go a little bit further, we can see the white ship here, and this is also harbor. This is the harbor for the cruise ships. All the cruise ships are landing here, and they're beginning their tour here, and you will see the big ship there, It's leaving now the Bosporus. It comes, the Bosporus opens in the other hand side that we will see to the Black Sea, and this is the Mediterranean Sea, and so they pass now to the Mediterranean Sea, go over the Dardanelles to where else they want.
Welcome. Merhabalar.
We are welcome with our Dr. Erkan.
Welcome.
Thank you very much. So I assume we are here at the reception area. Hello. Who do we have here? What is the name?
Kedinin adı ne? Ne diyoruz kediye?
Hello.
Eros.
Nice meeting with you. Is it?
Says welcome.
So tell us much about this reception. Is it that clients come here, make an appointment, or anybody could walk in whenever they need some service?
Resepsiyonumuz, ultrason odamız,
Yes, they come here
Radiologic
and they
room.
get other appointments from here.
I
This
see.
clinic is working only on appointment. You have to call first,
Okay.
and then according to your appointment, you come here, and now you see the clinic, and in the entrance side, you see a very good ultrasound room.
And this is a room where most of the referral cases come in.
Yes, bu daha çok referral hastaların geldiği ve kullandığınız oda, doğru mu?
Doğru. Hı hı.
Yes, and also he's using his ultrasound for every patient for him because he's the normal standard examining part of him.
I understand ultrasound has become one of the most important diagnostic
Yes,
tools.
yes.
So I
Yes.
think this is a very interesting thing. Yeah.
For this clinic, yes.
Yes. Then from here we go to the other area.
Hematoloji, biochemical laboratuvar.
So what is this area, please?
Bu alan laboratuvarımız. Hematoloji,
Hematoloji,
biyokimya,
Chemistry.
biochemistry.
So blood chemistry and complete.
IDEX, Fuji, hı hı.
I see.
Full laboratuvar systems.
Wonderful.
they are making all lab work in this area for this clinic.
Uh-huh.
They also have PCR.
Yes.
Good. So these are our supplements.
Yes.
Used, I see. Mhm. So is supplements are used for all animals, or you see what their need is, then you try to recommend them supplements. Like if there's an older animal has some problem with bones, then you try to give them something
Hepsi
supplements
aslında.
so that it could help them. Yeah?
Supplementleri bütün hayvanlara mı veriyorsunuz yoksa hastalıklarına göre reçete mi ediyorsunuz? Mesela yaşlı bir hayvana kemikle ilgili supplement vermek gibi.
Hepsi. Yani hem hastalıklarına göre veriyoruz, hem koruyucu hekimlik, hem interaktif, hem longevity.
We use it for every case. I mean, we sometimes give according to their illness, and sometimes we use them for preventive.
Okay. Preventive.
Yes.
Preventive of this.
According to the animal, they use
I see.
name.
So this is a radiology room. I understand you have to turn the lights down when you take the radiograph. Yeah, so this is a very clear image you have.
Diğer systems.
Yeah. So I assume it's all electronic.
Diğer systems, Fuji.
Yes, it's electronic.
Uh-huh.
ER system from Fuji.
Fuji, okay. Yeah, very good.
İkinci bir oda.
İkinci muayene odamız. Burada köpek hastalarımızı kabul ediyoruz. İşte tartılı bir masa, inip kalkabilen, yükseltilebilen bir masa.
This is our second
Göz ve kulak
examining
muayenesi yapabiliyoruz.
room. We can make ear and eye control here, and also our table is flexible, and also we can measure the weight of the animal here with this table.
I'm really impressed that you have the hydraulic table
Yes.
because I have almost broken my back getting down to the floor to try to do, acupuncture. So this is a smart thing you're doing it. Before you get too old, it's good to have a hydraulic table. Yeah.
Çok etkilendim çünkü ben akupunktur için hayvanları indirip kaldırırken sırtımı incittim. Çok akıllıca olmuş. Önce şey.
Yeah. So please tell me about this area. I see quite a few cats here.
Burada birkaç kedi görüyorum bu alan hakkında bilgi verir misin?
Bunların hepsi felçli.
They are all paraplegic.
Bazıları yürüyemiyor, bazıları yürüyor ama defekasyon, ürinasyon negatif.
Some can walk, but not urinate or defecate by themselves.
So these cats are essentially abandoned from the owners, and these are adopted by you to keep them here.
Bunlar hayvan sahipleri tarafından atılıp senin aldığın hayvanlar mı?
Evet.
Yes, some of them like that. Some
Artık
of them,
benim.
he found them from the street, and he never makes euthanasia to any animals.
Mesela 13 yıl önce terk edildi.
This is for 13 years he is taking care of the cat.
13 years.
Evet. 12.
12 years.
So this is quite a bit expensive, in fact, to maintain all these animals for their long time. Yeah.
They think they must euthanasia. And he said, no, I can take care of them. And then he is looking after more than 10 years.
That is admirable. So what is this room here? I see quite a few cats here too.
Burada hastalara günlük serumlarını veriyoruz ve günlük bakımlarını yapıyoruz. Ufak köpekler ve kediler için bir oda.
This is the main place we make our patients daily infusions and take care of them. Normally we have cats and small breed dogs here.
I see.
So these cages are enough for us.
So we can say that this is almost like what we call inpatient.
Yes.
Yes.
Yes.
That they have to stay in the hospital for
Yes.
different reasons, just like some of these animals are on fluids
Yes.
because they're inpatients. Yeah. So yeah, okay.
Işığı
So this is probably mostly for the technicians to come and work in.
Normally in this clinic, in this room, there's one technician and one veterinarian every time. They are out now because we are taking video here.
Yes.
So when the animals are staying here, they are always under control.
That's very good. Yeah, please tell us something about this room. Is this a surgery room?
Bu oda hakkında bize bilgi verir misin? Operasyon odası.
Burası bir operasyon odası. Bazı ameliyatları yaptığımız bir oda. Aynı zamanda burada diş çalışıyoruz ve endoskopi çalışıyoruz.
This is the operation room. We make some of them here, and also we are working on dentistry, and we are making our endoscopy here.
Yeah, very, very nice.